So in this video, we are going to discuss about fetal circulation. This is placenta. This is umbilical cord. This is the fetus. We'll start from the placenta. So this umbilical cord, this consists of three blood vessels. It consists of three blood vessels. Out of them, there are two umbilical artery and one umbilical vein. So there are two umbilical arteries and one umbilical vein. This one umbilical vein, we can also call it as left umbilical vein. Then where is the right umbilical vein? So in the early embryo, both left and right umbilical veins are present, but as the development progresses, the right umbilical vein disappears or degenerates. Only the left umbilical vein persists, and it becomes a single umbilical vein in the umbilical cord. So these umbilical veins they carry oxygenated blood, and the umbilical arteries they carry deoxygenated blood. So from the placenta, oxygenated blood via the left umbilical vein reaches the fetus. So from blood is now in the left umbilical vein, it is oxygenated blood. So the oxygen saturation here is around 80%. So the oxygen saturation of blood in the left umbilical vein is around 80%. From the left umbilical vein, now the left umbilical vein passes through liver. So this is our liver. So from the liver, the left umbilical vein passes through the liver and reaches the inferior vena cava. So it reaches the inferior vena cava, and there is another sound that is directly connected in between inferior vena cava and left umbilical vein. This sound is known as ductus venosus. Actually, most of the blood from the left umbilical vein it passes through the ductus venosus and reaches the IVC. Very few amount of blood goes through the liver and reaches the IVC. Now from the IVC there is SVC also present. From the IVC and SVC, the blood drains into right atrium. Now I'm drawing right ventricle. This is left atrium. This is left ventricle. So in fetus, there is a link between right atrium and left atrium. This is called foramen ovale. This is the opening between left atrium and right atrium. You can say it is a defect of intra-atrial septum. Uh, so the blood when reaches here, the blood comes here inferior vena cava, and the blood in the right atrium. From the right atrium through foramen ovale, blood goes to left atrium, and some amount of blood also goes to right ventricle. But most of the blood from the right atrium it goes to left atrium only. So from the left atrium, the blood goes to left ventricle. So from the left ventricle, the blood goes to aorta, and from the aorta, the oxygenated blood goes to brain, and from the brain again the deoxygenated blood comes via the superior vena cava and reaches the right atrium. Some most amount of blood goes to right left atrium, and very few amount of blood it goes to right ventricle. So from the right ventricle then opens into pulmonary trunk. Now the blood from the right ventricle it goes to the pulmonary trunk, and pulmonary trunk and aorta they have also a connection between them. So the connection between pulmonary trunk and aorta is a shunt. This is called ductus arteriosus. So ductus arteriosus is a shunt in between uh, pulmonary trunk and aorta. So now the blood from the right ventricle goes to pulmonary trunk, and blood from the pulmonary trunk leads to lungs. But in case of fetus, the resistance in the blood vessels of lung is very high, so the blood can't go to the lungs, so she redirected to the aorta through ductus arteriosus. So from the aorta, again blood supplies to brain. Now from the aorta, the blood goes to the brain, and it also goes to the common iliac artery. And from the common iliac arteries, and two arteries arise. There are umbilical arteries. They are umbilical arteries. And these two umbilical arteries again mm, connected to the placenta, and this umbilical artery it carries deoxygenated blood. Now the oxygenated blood comes here, and in all these process, this oxygenated blood gets deoxygenated, and the oxygen saturation in the umbilical artery is around 58%. So the oxygen saturation in the umbilical artery is 58%. Now it goes to the placenta. Now we'll discuss this whole thing in an image. So this is adult circulation. Here you can see there is ligamentum arteriosum. This is ductus arteriosus which is present in the fetus. It converted into ligamentum arteriosus in the adults. So there is no link in between pulmonary trunk and aorta. So this is one thing. Another thing is that blood from the lungs is also coming via the pulmonary vein into left atrium, and blood from the left atrium it is going to left ventricle pumping the blood through aorta, and the blood from the aorta is also going whole of the body. There is the umbilical artery is now converted into medial umbilical ligament in an adult, and there is no you can see here it is Doctor's venous is present, it is non Doctor's venous is absent. So what happens to Doctor's venous, we will discuss that later, but this is an adult circulation. So this is our fetal circulation, and we'll review it once again. So this is our placenta. So blood from the placenta it goes uh, via the umbilical vein. The blood from the umbilical vein, it most of the blood it bypasses the liver and it goes through ductus venosus. And now the blood from the ductus venosus it reaches the inferior vena cava. And now blood from the inferior vena cava reaches the right atrium. And from the right atrium, there is a link between right atrium and left atrium. That link is called foramen ovale. So now blood is present in the left atrium. From the left atrium, blood goes to the left ventricle. Now from the left ventricle, the blood is again pumped into aorta, and from the aorta it goes down. And what happens here? Less amount of blood from the right ventricle, right atrium reaches the right ventricle. From the right ventricle, through the pulmonary trunk, blood goes and it is redirected from the lungs as there is high resistance of the arteries of the lungs. So it goes to the aorta via ductus arteriosus. Ductus arteriosus it is a link between ductus arteriosus is a link between the pulmonary trunk and aorta. So now from the aorta, the blood goes and now descending aorta and umbilical arteries are formed from the this is common iliac artery, umbilical arteries are formed, and these umbilical arteries they again merge with the umbilical vein to form the umbilical cord. So this is fetal circulation, and this is adult circulation. So there are structures like ductus arteriosus. Later it becomes ligamentum arteriosum. So when the fetus is present inside mother's uterus, there is a link between pulmonary trunk and aorta that is called ductus arteriosus. So it is kept open by uh, the prostaglandins like PGE1, PGE2, which keeps the ductus arteriosus open in the intrauterine line. So after birth, um, the baby takes air through the lungs. So during the initial inflation of the lungs, there is a substance released from the lungs that is called bradykinin. So this bradykinin helps in the closure of the ductus arteriosus after birth. Immediately after birth, there is a first there is functional closure, then there is anatomical closure after 1 to 3 months. So after birth, there is first functional closure of ductus arteriosus, and after a few months, 1 to 3 months to be more specific, there is anatomical closure. So what happens with functional closure? That the blood vessel constrict and no blood from the pulmonary trunk goes to the aorta. So after a few months, there will be fibrosis and ligamentum arteriosum will be found. So what happens after birth? So blood from the pulmonary trunk it goes to the lungs as this is closed now. So blood now goes to the lungs. After birth, the resistance in the lung arteries also decrease. So now blood from the pulmonary trunk goes to lungs, and there will be respiration, inspiration, So after that, now the blood from the lungs, oxygenated blood, comes to the left atrium. From the left atrium, now there will be increased pressure inside the left atrium and decreased pressure inside the right atrium. Why? So first there will be umbilical vein. It was supplying the inferior vena cava and it was increasing the pressure in the right atrium. So after birth, this umbilical cord is cut. So umbilical vein is also cut. Then there will be decreased pressure inside the left atrium and there is increased pressure inside the right atrium due to lungs. Blood from the pulmonary vein comes to the lungs, from the lungs comes to the left atrium, and there is increased pressure inside the left atrium and decreased pressure inside the right atrium. So it will leads to the closure of foramen ovale. So I told you that foramen ovale is a link between left atrium and right atrium. So after birth, due to all these processes, there will be closure of foramen ovale. So how this foramen ovale will close? So septum primum and septum secundum. Now the septum primum will fuse with the septum secundum and fuse with the septum secundum, and there will be finally the closure of the foramen ovale. Now the foramen ovale is closed. Now blood from the left atrium or right atrium do not cross each other, and they go to the both ventricles. So this was before a series connection, and now it is a parallel connection. You can remember it like that. So this is a story about Dr. Satyrs. So, in some cases, this Dr. Satyrs is patent, so it is not closed. So, how it is closed after birth? I told you when we inflate the lung and take breath, and baby take breath after birth, the air goes into the lungs of the baby. There is a substance called bradykinin. Now, the bradykinin is released. Bradykinin leads to the closure of Dr. Satyrs. That later becomes ligamentum arteriosum. So the Dr. Attrition is closed, not closed. It is patent. Its condition is called patent Dr. Attrition or PT. So now what happens? Now uh, blood from the left ventricle goes to the aorta and left ventricle pressure is more. So from the left ventricle, the blood goes to the aorta and from the aorta, due to all these things, from the left ventricle, blood goes to aorta, and from the aorta, the blood backflows into the pulmonary trunk via the Dr. So because it is present and there is high pressure inside the aorta. Now this blood uh, goes to the lungs, and from the lungs, it goes to the left atrium and left ventricle, aorta, and there will be circulation like happening this. This leads to acyanotic congenital heart disease. Acyanotic congenital heart disease. So this is a patent Dr. Satyrosis. So what drugs will use to there is medical management. So in drugs this is kept open due to prostaglandin. So we have to give drugs that will decrease prostaglandin. So what drug comes to mind that will decrease prostaglandin? That is obviously NSAIDs. So NSAIDs like indomethacin or ibuprofen, they can be used in management of fatal nocturosis. They help in decrease prostaglandin. Prostaglandin helps in PGE1E2. They help in the opening of nocturosis. So drugs like indomethacin and ibuprofen they decrease prostaglandin and thus they lead to closure. In certain cases, we have to maintain a nocturosis kept open. So in that case, we can give prostaglandin analogs like alprostadil. They will keep the doctor status open. So that is also a case. Now what happens to other structures? So this is all your story about doctor statuses. Now what happens to other structures? Like there was sound, I was telling left umbilical vein. So what happens to left umbilical vein? So fast structure after in the fetus after birth that closes is the umbilical arteries. Umbilical arteries become medial umbilical ligaments. So after closure of the umbilical arteries, there will be closure of the umbilical veins. So umbilical vein, the left umbilical vein, it becomes ligamentum teres hepatis, or it is also known as the round ligament of liver. So the left umbilical vein, it becomes the ligamentum teres hepatis, or it is also known as the uh, round ligament of liver. So it is the inferior part of the falciparum ligament, and this is round ligament, or also known as ligamentum teres hepatis. So what is this? This is the remnant of left umbilical vein. And what is ligamentum venosum? This shunt, ductus venosum. This ductus venosum, it becomes ligamentum venosum. So ductus venosus becomes ligamentum venosum. You can see here, this is the pathway. It directly goes to the liver like this before, when it was left umbilical vein, and there was a shunt which bypasses the liver and reaches here. That shunt was ductus venosus. Now ductus venosus becomes ligamentum venosum, and this becomes the round ligament or the ligament of teres, and teres hepatis. So this what happens to the ductus venosum, ductus arteriosus, and umbilical vein, umbilical arteries. We discuss all of that. Now, in 20% of people, there is a gap between septum primum and septum secundum. There is failure of closure of the foramen ovale. That is called propatency of the foramen ovale. So, what is propatency of the foramen ovale? In some people, around 20% of people, there is a gap between septum primum and septum secundum. This is called propatency of the foramen ovale. So, what happens to septum primum? The septum primum becomes fossa ovalis. Septum secundum, it becomes limbus of fossa ovalis. Or it becomes the limbus of fossa ovalis. So, ductus venosus, there will be two types. One is functional closure and the anatomical closure. So, in case of ductus venosus, the functional closure occurs after the removal of placenta, obviously, and after 7 days there will be anatomical closure also. So, in case of foramen ovale, right after birth, uh, during first breath of the child, there will be functional closure of the foramen ovale, and months to years later, there will be anatomical closure of the foramen ovale. And Dr. Saterius, 10 to 15 hours after birth, that is functional closure, and after 1 to 3 months, that is anatomical closure. So, this is all about fetal circulation. So, we have to remember from the placenta, blood goes to the left umbilical vein, then how it reaches the inferior vena cava. From the inferior vena cava, it goes to right atrium. From the right atrium, goes to left atrium through the foramen ovale. Now, from the left atrium, goes to left ventricle, aorta, and this is pulmonary trunk. There is a link between pulmonary trunk and aorta that is known as ductus arteriosus. How the blood goes to the common iliac artery. From the common iliac artery, blood goes to umbilical artery, and from the umbilical artery blood again back to placenta. So this is whole of fetal circulation. So this is all about today's video. We discussed fetal circulation in detail. So we started from the placenta, and now we are ending from the placenta also. So this is a video about fetal circulation. Now I will try to make videos about the congenital heart defects in a child, cyanotic, acyanotic heart defects. So stay tuned.